John, I wanted to ask each one of you if you could just briefly tell us a little bit about your diagnosis and in a short excerpt, and how it's been for you.
Sure, I'll do that as quickly as I can. October 2015, I noticed a little lesion about the size of a pencil eraser on my cheek, and I had an appointment 5 weeks later with my dermatologist, so I thought better get her to check that. She took it off. It was a melanoma. And I have to say, I was never a sun lover. I've all my life tried to stay out of the sun, so I really can't blame the sun, I don't think. I had 2 lymph node dissections, both of which turned out to have tumors in them. And we thought we had it. I was about to have some radiation, and I discovered 2 more bumps on my cheek. And so we went back and did a repeat CT, head, neck, chest, abdo, pelvis. Make a long story short, discovered 9 tumors in my lungs and 1 on my liver and 1 on my adrenal gland, and that's in the space of about 3.5, 4 months. So I immediately started on IPI and Nevo both, 3 doses of that. Developed some neuro symptoms, and I had a few other little symptoms, a little bit of rash, a little bit of itch, a little bit of vitiligo, probably not pronouncing that right later on. But I developed some neuro symptoms. Turned out the 2 drugs were irritating a little benign lesion in the lining of my brain, which we had found when we did the first series of scans. Neurosurgeon decided that needed to come out, so I had a little pause in my immunotherapy while I had brain surgery, and I came out of the brain surgery with a left arm and leg that no longer worked. So 8 weeks in active inpatient rehab, learned to walk again, learned pretty much to use my arm and hand again, can't write worth a damn. Resumed the nivolumab on its own, 2 full years of that. Last week I had a CT scan, and I'm now 1 year finished from the immunotherapy treatment, and all the tumors in my body are down to shriveled up little nothing and stable.
Wow. And Jessica. Hi.
Hi. So I was diagnosed also in October 2015. I had just had my daughter. She was about 5-6 months at the time, and I have lots of moles and freckles, and one in particular changed while I was pregnant with her. But my GP and my OB both said, you know what, it's probably normal pregnancy changes, just get it checked after you deliver, which I did, but obviously I was busy with the newborn, and it took me about 6 months to get in with the derm. He removed it right then and there, and he tried to foreshadow that it was serious, and 2 weeks later I was at Sunnybrook with a surgical oncologist. I had surgery, and it did progress to my sentinel node, but not further, so I'm stage 3A, and at the time I had the choice between interferon and nothing. So I did interferon. As a new mom, I couldn't just not do something. And I knew it was going to be awful, and they told me it was going to be awful, and I lasted 10 months out of 12. I lost a lot of weight. I lost almost all my hair. I was clinically depressed and clinically, I was on medication for anxiety. It was horrible. But since then, all good. So I've had CTs at first it was every 3 months. I'm also getting my ultrasounds of the lymph nodes in my left groin ultrasounded every 4 months. And so far, so good. So it's been about 3.5 years.
And Glen, tell us a little bit about your experience.
Hi, my name's Glen. So I went to the doctor for a physical in July last year, and she looked at a spot just above my ankle, and she wasn't sure what it was. She said go to the dermatologist. The dermatologist looked at it, and he wasn't sure either. He called a couple other guys in, so they did a biopsy, and he called me. Actually, I made an appointment right then, and I went to see him next week, and he was telling me about it, and in all honesty, I didn't understand anything he was saying. It was just like, I didn't realize I had cancer or anything. I just kind of left. He goes, you got to go see Sunnybrook, go down to see Dr. Petrella and Dr. Wright. So I went down there and they did the surgery, and it was they said it was cancer stage 3C, and I just did that, and then at that time they were just approving the Nivolumab for stage 3, so I had to wait. I was approved for that because I had to be approved within 3 months. So I went to the Bayshore Clinic in Richmond Hill because I live in Newmarket, and I walked in, they did it, I get home, I said, well, this is easy, it was nothing. The following 2 weeks later, I went back, and within 10 minutes, I had a anaphylactic reaction, and that wasn't good. And so then I missed 2 weeks, and I went back to Dr. Petrella. She goes, "I want to try it again. We'll do it here with the steroid and Benadryl." So I left my house. I thought I was going to die. That could be my last day, so I made sure it was clean in the house in case it was dead.
Oh boy, that's for sure.
Yeah. So it went well, and then that went on for a few weeks, and then they did a CAT scan. I got something wrong with my lungs, and I don't know what the word is, but it's not pneumonia, but it's like the lining. So I went on a steroid, which I think is called prednisone or something, and that's gained weight. And then I came off that. There's still a problem with my lungs because of it, and I'm on it still. So I'm waiting for another 6 weeks, and then I'm going to go back on the MAD. I say Opdivo because I can remember that, but anyways, that's it. And I'm positive. I just want to say my wife's awesome. That's why I'm here, and I try to stay positive everything. And Dr. Petrella's like the best doctor in Sunnybrook, and Dr. Wright's awesome. You're awesome. Everybody's awesome. Thank you.
Well, thank you. I mean, I think it's so important for people out in the audience that are either in treatment or have been through treatment and are still coping with some of the side effects or issues related to hear people can not only do well, but thrive after treatment, and I think it's important that we have hope. That's really key to this disease. So one of my other questions is based on that hope. You know, all of you have been through quite an ordeal, one would say. Was there any strategies that you used or you employed that helped keep you centered and moving forward?
Can I start again?
Sure, you can.
I need to share one other little bit with you. My cancer arrived in October 2015. On Valentine's Day 2012, my wife was diagnosed with advanced staged ovarian cancer, and frankly, we learned our coping strategies in the 2 or 3 weeks that followed that. The good care of Joan Murphy, Dr. Butler, who you'll know well. So we've been on a long journey for a long time about dealing with life-threatening cancers, and after 2 or 3 weeks of weepy stress, we both decided enough of that, let's get on and deal with this, and tried to make a positive approach to life as we struggled with it. And I think it's fair to say we have both really benefited from an all-out effort to fight against these diseases. And fight means, in some cases, learning a lot. In some cases, it means helping organizations like Melanoma Network and Ovarian Cancer Canada to inform people and to raise funds and all that sort of stuff. I know if Barbara were here, she would say, and I've learned a lot from her, the most beneficial thing she has done through the 7+ years of living with her cancer is reaching out and supporting other women who have been diagnosed, who are struggling with this disease. She's got a whole group of people that she contacts regularly. I guess I also need to say I've done some of that kind of thing myself. We know very well that we are blessed because we have each other and a great family, and we're reasonably well off and all that sort of stuff. But for us, a big part of getting through this has been maintaining a positive attitude, learning all that we can, helping other people, and never losing sight of the most important thing of all, which is hope.
Thank you, Jen.
I don't have to answer now. I think for me, in the beginning, I say with the distress, I was an information gatherer. I needed to know everything, and that almost went too far. But that's just me. I needed to just have all the papers and all the research and ask all the questions and all the lists. But a couple years out, with of course the normal supports of amazing family and friends, to carry me along was being a part of this amazing community that the melanoma patients have provided. And I've done a lot of patient outreach and peer-to-peer support, and there's nothing like that bond that gets created when you speak to someone who could really relate to what you've been going through. You know, even your closest family and friends won't really understand. So I would have to say that was huge for me, is talking to other patients, being able to share my story and then letting them share theirs with me. It helps me too.
Absolutely.
Mhm.
Can you repeat the question?
Absolutely. I was just asking, it can be, overwhelming to have a diagnosis of
Okay,
cancer. And then just what has helped you get through and move through this?
Okay, so I'm diabetic. I've been on insulin for over 30 years. I had the flesh-eating disease on my foot when I was in my 20s. I had my retina become detached. So my attitude was, bring it on. Let's do it. It's an easier way of saying it, but at first I was overwhelmed. I went to the Doan House Hospice in Newmarket. They helped me. I went there. I reached out to the Melanoma Foundation. It was absolutely amazing. The Wellness Center at Sunnybrook helped me. My wife, obviously, thank you for, we've been married 29 years. I wear the pants in the family, and she picks the color. So I just love being alive.
Yes.
I don't care if I'm going to die tomorrow. I'm still going down with a positive attitude, and I've been able to surround myself my whole life. Everybody around me is positive. Negative people hate me. And can I tell my joke now, or should I wait a minute? Did you hear about the two antennas that got married?
Not again.
The wedding wasn't that good, but the reception was excellent.
Okay. Yes, sir.
Can I say one other thing? I wanted to share my perspective for two of the questions later on. The first was about the lady who's feeling anxiety about beginning to treat her treatment right here. And I would say to you, from my experience, probably a lot of your anxiety is coming from fear of the unknown. And when you get there, it's not going to be quite as scary as you think. And I got to say, as somebody who's spent a lot of time in governing hospitals and all that stuff, I have never found anywhere as supportive, top to bottom, as the people who work in cancer hospitals. And for the lady over here who was worried about her warring relatives and different approaches things, remind them every now and again, it's really about you, not about them.
Good insights as well. Thank you. Okay. So fear of recurrence is a common issue that patients face. I think pretty much a good portion of us live with that. If this is your experience, what have you done to sort of, move you forward? It might be related to what you've already talked about, but any thoughts on that? Living with fear of recurrence.
Would you start?
I'm going to go.
Yes.
Thank you.
Processing. Okay, that's the analytic.
Want me to go first?
Sure.
Well, I have cancer the same as you do on my above my ankle, and it came back 3 times.
Yeah, what the heck?
So I figure it's coming back. I'm not going to worry about. I can't control anything except I've learned how to live in the moment, and every goal I've ever set, I've accomplished in my life. So I'm just continuing on. I don't know how long I'm going to live, but it's going to be good, and that's my attitude. I don't know what else to say. That's basically
That's
it.
pretty awesome.
I was just going to say that I comment to my wife every now and again through my own journey, leave hers aside for a moment. I don't ever remember getting panicky or scared or depressed or anything like that, including the moment at the end of my brain surgery, which I had wide awake, by the way. And I realized before they even took that thing they bolt onto your head off that I couldn't move my left arm and my left leg. Even then, I don't remember being panicky or depressed or anything. I just thought, it's what Glen said a few minutes ago, bring it on. Here's another challenge, got to deal with it. Let's gather the facts and work away at it. And here I am, a 72-year-old lifelong learner, still chugging away.
Awesome.
Just one more comment, and it's all about finding peer support, finding help, finding information. Those are absolutely vital tools to dealing with what you have to deal with. Melanoma Network obviously is a real go-to resource for that. Your own healthcare professionals are go-to resources for that. And just repeat the experience that Barb and I have had of being available to people who want to reach out to us and talk about what's happening. And I'd make that offer to you here tonight too, if I personally could be of any help to you in coping with your disease at some point. Come and talk with me and we'll connect.
Absolutely.
I just want, I'm the same, like I was gonna say, I live in Newmarket, and if anybody, I'd like to see a support group start in Newmarket, like I'd do whatever it takes to help that. And if anybody wants to call me or talk to me, I'm gonna help or tell you a dad joke.
Yeah, bad joke.
And I'll be at the walk in Sunnybrook. I do photography, so I was at the Melanoma Masquerade Ball, which was awesome.
Thank you.
And I'll be at everything that is needed, and I'll be there at the walk. And I just love positive energy, and if anybody doesn't have positive energy and they want it, come talk to me.
Awesome. Awesome. Well, we thank all of you. It takes courage to get up and tell your story.